Thank you, Chair. I have a number of questions for each one of the witnesses who've been so generous with their time and expertise, so I'll cut to the chase. Ms. Valerian, I'll start with you. Thank you very much. I want to ask you, given what we've heard from Senator Seidman and from you, conflicting evidence on different questions. There is no single point I believe that scientists are agreeing on. Given all of this, what would you say to a proposal that even if we approve C-45, its implementation should be delayed for a year at least until we understand more fully the science and the impact? What impact would that have on young people, for instance?
Okay, so I would say that thank you very much for your question. I would say first, considering that, young people and Canadians more broadly are continuing to be criminalized in the interim for possession and use, I think that that's of critical importance of why, we really do need timely passage of Bill C-45. I would also point to the fact that individuals are already using cannabis at relatively high rates, and we shouldn't waste any more time in bringing this into a legal framework where we can start to address questions around public education and access to that information and evidence-based policy. Those numbers are already, quite relatively high, so I think we shouldn't waste any time in terms of being able to bring education and harm reduction to the public.
Anybody else? I thought you said you had other.
No, I have
other
questions.
Go ahead.
So I'm trying to be efficient here, Chair. For Mr. O'Soup, I was interested in knowing what your position and the position of your organization is on home cultivation and the impact or the potential for harm that home cultivation poses to young people. The legislation will allow for up to 4 cannabis plants in every private residence for personal use from seedlings or licensed seeds, and there will be strict monitoring, and of course provinces can choose to further regulate and legislate as they choose. But I was wondering, you didn't mention that in your remarks.
I only had 7 minutes, so
okay,
I had to.
Good. I'm glad I give you a few more.
Had to use my time wisely there.
Yeah.
When it comes to home cultivation, our organization, yes, we are an advocate for children and youth, but we're also, we extend that to advocating for families, because we can't advocate for healthy children and youth if we don't advocate for healthy families as well. So I believe that responsible cultivation at home should be tightly monitored, because there is a process there that can lead to parents cultivating and then that transferring to the kids and different things like that we have to consider, because the parents are the role models in our kids' lives, and if they see their parents doing that, then there's a trickle-down effect to that. So, for us to advocate for healthy children and youth, we have to advocate for healthy families. So, we haven't put out an official stance on that, but just reacting to the question, I think that's where we put our stance on.
And how would you, monitor or enforce that? That's the big question. And I have a secondary question. And how would you compare limiting, because I'm hearing you talk about model parenting in a way, and what lessons would you derive from the current laws that allow individuals to grow tobacco and to brew alcohol?
Yeah, I think it would be pretty difficult to monitor, but we work closely with our justice system in Saskatchewan, and I think we'd have to have those discussions with them, because I think it'll be different probably all across the country. And sorry, what's the second part of the question?
Actually, I think.
Okay.
That's okay.
Quick.
Do I have another
Yes,
one?
yes, if you do it quickly.
Less is more. Miss Jenkins, I was really interested in reading your testimony, and you quoted a young person in your study who says they think all drugs are not that bad, so when they go into the drug thing and they think all drugs won't change them, but those other drugs change you. My question is, in your opinion and your research, do you have any evidence to suggest that cannabis is a great gateway drug?
No, we don't have evidence to suggest that it's a gateway drug, and in fact, I think that's been widely disputed at this point. In fact, in one of our studies, we had youth looking through the literature and drawing conclusions, and they were also able to conclude that that was not an accurate claim to be made. I think the other interesting point that is in one of our studies, young people actually identified cannabis use as a harm reduction tool, and so we're using cannabis as a way to protect themselves from the harms of other harder drugs, as they call them. So instead of going that direction, we're relying on cannabis use.
Thank you very much. Yeah.